Hello and welcome back to the Gluten Free RN podcast. I'm Nadine your lovely host. Happy to be here with you for episode 14, where we're going to discuss recommended labs and follow-up for gluten intolerance and celiac disease patients. It's extremely important that we go over this information because I am finding out that not a lot of people are getting the correct testing or the correct follow-up after they are diagnosed with gluten intolerance or celiac disease. Hi everybody, welcome back to episode 14 of the Gluten Free RN podcast. I'm Nadine and we're going to get started with the recommended labs for gluten intolerance and celiac disease patients. So I'm a nurse and I like lab work to be done because it gives me valuable information as to how my patients are healing, where they're starting out, what we can do to make people get better faster. Food is medicine and we like to approach it as such, but sometimes we have to take supplements. Sometimes people need to see other practitioners for things that need to be addressed, whether that's a doctor, a nurse practitioner, naturopath. There's many other practitioners that we can have on our healthcare team that can help us get better, certainly faster, but definitely over time. I myself have been on at least a gluten-free diet for now 10 years as of October 2006. And over time, I've learned a lot about gluten intolerance and celiac disease follow-up. I've heard thousands of people's stories. And what I found out is that there's a lot of different ways that people either don't get tested or treated or followed up. And that's a little concerning. There should be a lot of standardization in the celiac testing. There should be standardization in the follow-up that's recommended. And depending on who your practitioner is, that may or may not get done. So it is very important. I myself have follow-up lab done to make sure that I'm absorbing nutrients appropriately, to make sure that my body is healing, and it gives me excellent information as to how to tweak my diet or add some supplements that I may have thought I was getting but found out I wasn't, or not absorbing them appropriately. So again, valuable information. Of course, we initially want to have a celiac panel done. That's just for a baseline to see where you're starting out. Keep in mind that celiac panels, the way they're traditionally done in the United States, are 70% false negative. And there's a number of reasons for that. If you get a positive celiac blood panel, then you have damage somewhere, especially if the TTG2 and the endomyocele antibody are positive. If you have a positive anti-TTG and a positive anti-EMA, then you have gut damage somewhere, whether the doctors can find it on biopsy or not. The other interesting thing about the celiac panels themselves is that you can have a negative celiac antibody panel in January, and by April, it's positive. That's called seroconversion. That means that in January, you didn't have enough intestinal damage to test positive for celiac disease, but by April, there was enough damage and your body was mounting an antibody response. The other issues with the celiac antibody panel can be lab-to-lab variability, both in the ranges of what's read as normal or abnormal, and how the test is actually run. So there is lab-to-lab variability, which can be a problem. And the other major issue with the celiac antibody panel is it must include a total IgA and a total IgG, a total immunoglobulin A and a total immunoglobulin G, which are simply put as IgA and IgG. But you have to have a total number, because if you're IgA deficient, then the celiac antibody panel cannot be positive because your body does not make enough IgA to actually mount an antibody response. That is very important. Even if it's a low on the range, then it needs to be looked at, especially if people are still symptomatic or if they have other family members that are determined to be celiac. If there's any question, then either further testing has to be implemented, different type of testing has to be implemented, or that person should be given an option of just going on a gluten-free diet because it is preventative for so many other healthcare issues, such as other autoimmune diseases, cancers, you name it. So it should be always an option. And I say that as someone whose antibody panel was negative and whose skin biopsy was negative for DH, but my DNA is such, it's a HLA-DQ2.5 homozygous, that's me, which puts me in the super celiac category or guaranteed to have celiac disease. So despite the fact that my blood test was negative, I honestly cannot explain that. And my skin biopsy was negative. Now I know that it was taken incorrectly. The biopsy was not performed correctly. So there's all kinds of errors that can occur. The interpretation of the information is problematic sometimes. It's almost every week that I hear somebody say that they had a celiac panel years ago, but it was not read correctly, or it was positive and they were not told. So if you have this testing, please make sure that somebody is reviewing it and that you're getting copies of all of your lab work, because doctors' offices close, clinics change hands, and you want to make sure that you have a paper copy of your medical records so that you have accumulated over your lifetime the labs that have been done, the reports of surgeries and procedures and testing, so that you have that in your hand and can take it to other practitioners. It's just good practice. So the celiac antibody should have at least 6 parts. It should have the total IgA, total IgG, the anti-tissue transglutaminase 2, and a DGP or deaminated gliadin peptide. I like to always see an anti-gliadin antibody, which is an AGA. That's a great biomarker for people that are gluten intolerant, if not celiac disease. And then the anti-EMA or anti-endomycel antibody. Those pieces and parts have to be part of that test. You can't just do a TTG and say that a person is negative for celiac disease. That just doesn't work out that way. You need all those puzzle pieces together in order to correctly test a person for celiac disease. Ideally, I like to see an Array 3 from Cyrex lab run, but again, that also has to be with a total IgA, total IgG, and that has to be ordered separately. So Cyrex Labs does a great job of testing people for celiac disease with over 25 biomarkers for celiac disease and gluten intolerance. So it is pretty comprehensive. Again, it's a snapshot of what's going on today. So that test could be negative one day, and then in a couple months in the future, it could turn out to be positive. So not one of these tests will rule you out forever for celiac disease. Just because you don't test positive today for celiac disease, that does not mean that you're never going to develop it. I'd like you to keep in mind that any person of any ethnicity at any age with any symptom or completely without symptoms can develop celiac disease. So you can be ruled in for celiac disease, but at this point in history, you can never be ruled out. We know the trigger for celiac disease is eating gluten, so one of the preventative things we could do is potentially tell people, hey, you know what? If you don't ever want to develop celiac disease and the complications that go along with that, you can go on a gluten-free diet. Just make sure that it's 100% gluten-free. You're not cheating. you're not inadvertently getting gluten, and stay on that diet. Even if someone says you need to go on a gluten challenge so that we can prove you have celiac disease, please don't do that. You can actually cause irreparable damage by adding gluten back in your diet. And what that means is you can cause damage to your intestines that does not heal, even going back on a gluten-free diet. So there is no reason, no medical reason, and certainly no social reason in the United States at this point that you should or need to go back to eating gluten to prove to anyone that you have celiac disease. That whole idea is fraught with problems and errors and potential irreversible damage. So we should never be trying to cause organ damage. We should be trying to heal organ damage and trying to make it better and make it easier for people to be on a gluten-free diet. So ideally, if you can get an Array 3 from Cyrex Labs, that's perfect. And then make sure that you have a practitioner that can interpret that for you and work with you. But again, you have to have a total IgA and a total IgG run with that. And that has to be ordered separately. The other option is to get a stool analysis from Entero Lab, and that's ENTERO Lab, L-A-B. You can order it yourself over the internet. It's relatively inexpensive. If you need help, you can call Entero Lab about determining which labs are most appropriate for you. It is a stool analysis, so it's not a blood test, which means you order what you want off the internet. Entero Lab will send you a test kit. You essentially poop in a bucket, freeze it, and then mail your poop to Texas. And then they analyze it. I have been encouraging people for years to send their poop to Texas because it's a great test. And you can also get a fecal fat score. And people go, what in the world is a fecal fat score and why do I care? The reality is that they used to test children for celiac disease using a fecal fat score, because if these kids were not absorbing their fat, even though they were eating it, then they couldn't absorb any other nutrients, including and especially vitamins A, D, E, and K, which are fat soluble. If they weren't absorbing those nutrients, they certainly weren't absorbing any other nutrients either. So they were starving or malnourished. So the Entero Lab testing is great, and they also do a DNA test. It's $149. It's a cheek swab, and you can mail it in. You can add that on to the stool analysis with the fecal fat score. You have to pay for it up front, but then you can submit that bill or any of these other invoices that you have to pay for up front to your insurance company, and they will pay. If they don't pay, please call me and let me know. These tests are medically necessary. I didn't make them up. There should be no barriers for you getting tested appropriately and timely for celiac disease and gluten intolerance. Most of these labs that you order on your own, you send them in, and within a week or 10 days, usually you will get the test results. If it's any longer than that, call the company and say, hey, I sent in my test kit and I haven't gotten my results. When do you expect the reports will be out? You can ask. But again, make sure that you submit the paid invoices to your insurance companies. If you have them at this point, welcome to America. We do not have universal health care. I've been working on that, and I'm trying diligently to make sure that everybody is covered and has health care. And so far, that's not happening. So we'll do the best we can with what we have. And if you have insurance, great, use it. Your insurance companies can and should pay for all of the celiac testing and certainly any of this follow-up testing that we're going to come across next. Included in your basic baseline testing for celiac disease should be a CBC, or complete blood count, and also a CMP, or complete metabolic panel. The CBC will give you your white blood cells, red blood cells, the breakdown of the red blood cells, whether they're healthy enough. You should have a platelet count in there. And all of that is very valuable information because your red blood cells point to your bone health. If your red blood cells are not healthy enough, if they're not the right shape and size, then we need to look back at your bones, because your red blood cells are made in your long bones. And the white blood cells actually point to your immune system. So we need to make sure that you have enough white blood cells, that they're healthy and are able to do their job of protecting your body from bacteria and infection. The CMP, or complete metabolic panel, is very important also. That will give us your electrolytes, your sodium, potassium, your chloride, also will tell us your calcium level, and what else is on a CMP? Oh, your glucose. Not only does that point to the health of your pancreas and your beta cells, but it also points to the liver health. So we want to make sure that your liver is actually capable of detoxing and your liver enzymes aren't bumped, because that sometimes can be the only indicator that you have celiac disease, is that some of your liver enzymes are bumped up a little bit. So we really want to keep an eye on that, especially for children. If you're not an alcoholic, if you have no other risk factors, we want to make sure that the liver is extremely healthy for so many reasons. Again, keep in mind that this is a multi-system, an entire body that is affected by gluten. It's not just your small intestines. You also have to have a baseline D3 level. That's one of your fat-soluble vitamins. It's extremely important. If that is low, and I would say anything below 40 is critically low, then we really need to look at all of your other fat-soluble vitamins or assume that they're low also. And that's A, E, and K. K is very important because if your K is low, that's the ability of your blood to clot. So some people will have bleeding gums or nosebleeds, or they'll bruise easily if they have a low vitamin K level, and they can spontaneously bleed. So we want to keep an eye on that. Make sure that all of your fat-soluble vitamins are at appropriate levels. Now, the D3, I like to see between 60 and 100. I don't worry about people overdosing on vitamin D3. It's very difficult to do, and it will clear. It's not going to cause any toxic overload. But it does have to be somewhere between, hopefully, 60 and 100. Anything below 40 is critically low, so that's part of your homework to find out what your D3 level is. It's also important to get your B6 and B12 tested. If you're deficient in B12, it could be a sign of pernicious anemia. And we want to make sure that your B12 is at the higher end of normal, or you can't really overdose on B12. It's a water-soluble vitamin. So even if it's over the normal range, or what's considered the normal range, I don't worry about that so much anymore, because it is a water-soluble vitamin and it clears relatively quickly. The one I do have some concerns about is B6. You can overdose on that. And if you have too much B6, then we worry about neurological symptoms that kind of pop up. Or some people will have neurological symptoms that don't go away. And sometimes that can be caused by a B6 level that is too high. Now, keep in mind that a lot of these people have not been absorbing nutrients appropriately for a long time. They go on a gluten-free diet, and then suddenly they're absorbing everything. We need to keep an eye on these levels to make sure, number one, that they're appropriately high or in the right range, and that you are absorbing them correctly, but they're not too high. Along with the B6 and B12, if you have any problems absorbing those vitamins, the B vitamins specifically, then I do recommend that people get an MTHFR gene test to find out if you're at risk for having difficulty utilizing the B vitamins despite taking them. So if you've had a 23andMe, then you can run that test through some other search engines, and they will actually give you different information. And you can determine whether you are a MTHFR gene carrier or not from the 23andMe information. One of the other things that I find fascinating is that a CMP, or complete metabolic panel, will give us the calcium level, which is very important, but that does not give us a magnesium level. That has to be ordered separately. And a serum magnesium level is not the same as a magnesium RBC test. And I like to see the magnesium RBC test over and above the serum/blood test. Here's the thing. In the emergency department, we never ever tested for magnesium levels, and I think they still don't. The interesting thing is every muscle in your body needs magnesium, including your heart. So we had all of those cardiac patients come in, some with arrhythmias or irregular heartbeats, and we never tested a magnesium level. I still can't wrap my head around that, but I highly recommend that you get your magnesium level tested, because if you have leg cramps or restless leg syndrome, or your muscles just kind of shimmer and shake and you don't know why, or you have twitches in your eyelid, it can all point to the fact that you are magnesium deficient. So it's important to figure that out. A zinc level is important. Every cell in your body needs zinc. And, what I found out too is my hair was falling out. Number one, I was anemic. Probably had something to do with that. I was severely malnourished, but my zinc was in the toity. It was low, low, low. So until I started taking zinc, I couldn't really, help my hair grow back or anything. Once I started taking zinc, my hair started to grow back in and fill back in, and I don't look like I have male pattern baldness anymore, which I did. It's not a good look. Don't go for that one, especially if you're not a man. Bald men can look very handsome and very stunning, and, it's not that big of a deal. But for women, when they lose their hair, that's a big deal, socially and emotionally and every other way. So I highly recommend that people find the underlying cause of that alopecia or hair loss. And if it's an autoimmune disease and we can correct that with a diet change, it's probably a good idea. So alopecia areata is hair loss, which is an autoimmune disease and can be corrected, but finding out your zinc level can be, again, a piece of the puzzle that we need to find out so we can advise supplementation. It's always a good idea to get an iodine level checked. One of my great friends, who's also a nurse, got sick right about the same time I did 10 years ago. And she would come and tell me, she was like, Nadine, I really feel like I'm going to die. I laid down in my bed and I honestly thought I was going to die. I didn't think I was going to get up. I thought that was it. I couldn't even move. I couldn't call anybody. And come to find out, her iodine level was tragically low. That's now corrected 10 years later. She feels great. She has more energy than she knows what to do with. And it was just a simple fix of going on a gluten-free diet and checking that iodine level. The fecal fat score we talked about earlier, that can either be done in a doctor's office. Docs don't usually order it routinely, but you can ask for it. And ask for one that gives you a number, that it actually gives you a range, and it just doesn't say within normal limits or fat absorption is normal. What I like about the Interolab fecal fat score is they will actually give you a number. So anything less than 300, provided you are eating fat, is considered to be normal. Anything over 300 is an indicator of malabsorption. Means that you're not absorbing fat, and therefore you are not absorbing your other nutrients. So shockingly, I get these tests back sometimes, and a fecal fat score will be 1200. That's not a good sign. So we really have to work very hard at getting people better, but this information is invaluable. A folate level, B9, is a good test to get. Ferritin level, again, going back to red blood cells, iron levels, and then a thyroid panel. Do you know how many people with gluten intolerance or celiac disease have thyroid issues? Almost everyone. It's crazy. So for some reason, the thyroid gland has a bullseye on it, and the gliadin proteins will either attack it or cause it irritation. I've worked with so many people that have had thyroid issues or had their thyroid ablated or taken out, And the reality is if we can catch those people before their thyroid is ablated or taken out, you can sometimes undo the damage just with a diet change. I myself had Graves' disease, and who knows what else was going on with my thyroid. On paper, it looked great, but clinically, not so great at all. So we really need to pay attention to the thyroid gland because it is very important. A bone density test, again, if you have any issues with anemia or blood dyscrasias or platelet counts, we have to look back at the bones. Are the bones healthy? And the bone health is not static. Those bones are not just sticks that hold our bodies up. They're very dynamic organs that can regenerate and rebuild and heal. So it's very important that we find out what the bone density is and then work to make sure that those bones are as healthy as possible. Because otherwise, people are at risk for osteomalacia, which are soft bones, osteoarthritis, osteopenia, who knows what else. And then at the end of that is, fractures. And some people are like, well, I just have fragile bones, or, I jump and my leg breaks or my backbones break. There's a problem there and it needs to be addressed. So especially children with multiple fractures or fractures that don't make any sense, have them tested for celiac disease first. And if a man is anemic and has osteoporosis, he has celiac disease until proven otherwise. One of the only ways for a man to have osteoporosis and anemia is to have celiac disease. So make sure that these men are tested appropriately for celiac disease. Please don't just assume you're supposed to be anemic because everybody in your family is anemic, or you have red hair, which is what I was told, or any other number of reasons. Make sure you get tested appropriately. I do recommend after a year or so that you get a test for small intestinal bacterial overgrowth, or SIBO. But that's after a year of being on a gluten-free diet or a paleo diet. And if you still have issues, that's a good test to get done. Always get a lipid panel done, and that's your cholesterol, your triglycerides. It's not always a good sign when somebody has a low cholesterol level or a low lipid panel. That can be an indicator that that person is not actually absorbing or utilizing the fat appropriately. And it is very important that you work with your practitioner to potentially just change your diet and not go on a statin or some other medications that are going to somehow lower your cholesterol and your lipid panel, but that doesn't treat the underlying issue. So as an emergency room nurse, we saw a lot of these patients that were on statins. Their cholesterol levels were within normal limits, but they were still in the emergency department with heart attacks. So obviously we were not preventing heart attacks by putting people on statins. Heart attacks and strokes and whatnot tend to be the end result of chronic inflammation. So really what we need to do is heal the intestines, heal the chronic inflammation, heal people's immune systems, and help them get healthy again. If you have any autoimmune issues, an ANA or an anti-nucleotide antibody is a test to get run if you're concerned about any autoimmune issue or disease. If it's positive, that's okay. It can be positive, but you realize that you can potentially reverse it. I myself did that strictly with going on a paleo diet. I'm happy to show you my lab work. And so that you can see that I did have, in fact, 2 positive ANAs, which means that I had autoimmune diseases, which I knew about. But after going on a paleo diet, that ANA panel turned out to be negative. So I don't have autoimmune diseases anymore. There is hope. If you have chronic inflammation, it's good to have an ESR, or Eastern Sedimentation Rate, test, or a CRP, C-reactive protein. Those tests are good indicators of inflammation in your body. Some of my patients are walking bags of inflammation, and they know it, they feel it, their body hurts, their joints ache, their brain is inflamed, And so we really need to work at healing the intestines to make that inflammation go away so that their body can heal. But having chronic inflammation is not a good idea because that inflammation is the basis for heart attacks, strokes, and so many other health issues. A stool analysis is always a good idea. There's several stool analysis tests on the market. Work with your practitioner to get one done, especially if you have issues with fat malabsorption. If you have SIBO, small intestinal bacterial overgrowth, it's a good idea to find out what your microbiome, how diverse they are, and if you have any. Sometimes I work with people without any immune system, and I'm working with more and more children without immune systems. It's a great idea to have an immune system for a number of reasons, to not have it be overactive or underactive, to actually balance it out. So sometimes that stool analysis can give us good hints as to what needs to be done to help your body heal. This is a fairly comprehensive list, but each person needs to be evaluated by their primary healthcare provider to establish which tests are necessary. The highlighted lab tests on this list are important baseline tests if you have just been diagnosed with celiac disease or gluten intolerance. There are other tests that can also be added, again, based on individual evaluation by your primary care provider. I do not recommend that people get any food allergy or food sensitivity testing until they have been on a gluten-free diet or a paleo diet for at least 6 months to a year. It takes 6 months to a year for your intestines to regenerate, for the villi to grow back. And in that time, your immune system is healing. So some people look like they're allergic to every food, and some people look like they're not allergic to anything, and they don't make sense. We actually have to wait for your immune system to settle down and to act appropriately to get rid of that inflammation so that it actually can identify bacteria, viruses, and isn't overreactive. If you have any questions about lab reports or how to interpret them, please call me, schedule an appointment for a consultation. We can go over all of these labs and I can give you my recommendations. Anything to help you get better faster or your family get better faster. I use my history and my experience and my knowledge as an emergency trauma critical care nurse to help you get better. I look at these labs completely differently now as a celiac disease expert than I did in the emergency department. There's different pieces and parts that I pay more attention to now than I would have in the emergency department. So again, if you have any questions or concerns about this, please let me know so that I can help you get the right information and submit the invoices to your insurance companies. They can and they will pay for them. And these are worldwide standards for people to get tested and followed up for celiac disease. So if there's any questions that your practitioners have, they are more than welcome to call me or email or text me with those questions so I can help them help you get better faster. Thank you for joining me on episode 14, where we reviewed the labs that are recommended for people that are newly diagnosed with gluten intolerance or celiac disease, and reasons for all those labs to be run. If you enjoyed this episode, please feel free to leave a review on iTunes or wherever you're accessing this information. It helps people actually find the Gluten Free RN podcast and helps them get better faster too. Thanks again for joining me on episode 14 of the Gluten Free RN podcast. It's a pleasure to have you listen to this information, and I really hope it helps get you and your family better. And if you have any concerns about, people not getting tested appropriately, please let me know so I can work with practitioners to get them educated about why this is so important. Have a great day. To your health, keep your chin up, be positive, and help me find other people that would benefit from this information. This is Nadine, the Gluten Free RN, signing off, episode 14. Cheers to your health and be gluten free. for good.